All right. Thank you all so much for joining us for our 2024 State Legislative Priorities webinar. My name is Timothy Jackson, pronoun he, him, and I'm the Senior Director of Policy and Advocacy at AIDS Foundation Chicago. And so I'm going to toss it over to my colleague, Aces, so he can introduce himself.
Hello, everybody. My name is Aces Lira. You see him, his pronouns, Policy Advocacy Manager here at AIDS Foundation Chicago. Pleasure to be here.
Thank you so much, Aces. And I just want to thank each of you all for joining us for today's webinar, where we're going to share our legislative priority agenda. And hopefully we will leave some time for you all to be able to ask some questions specific to our policy priorities. And we are just going to get right into it. So next screen, please. So I first want to kind of lay the groundwork with our policy priorities development process. What that looks like is we do our policy priorities development process, which is really a way that we begin usually in the summer to the early fall, where we do a number of listening sessions. We conducted 10 this year that are really designed to engage community on the policies, the things that they're seeing on the front lines that are impacting the lives of people living with and vulnerable to HIV, as well as people experiencing homelessness or housing instability. And so these listening sessions occurred, as I mentioned, over the course of the summer and fall of 2023, and included people living with HIV, people impacted by housing instability, healthcare and social service providers, advocates, case managers, and others. And we are so grateful to partner with so many agencies and community organizations and CABs and all of those to be able to hear directly from community about potential things that we can work on in the state legislative session. Also, a part of that work is really operationalizing AFC's intentional efforts when it comes to the principle that racism is a public health crisis. Understanding that we're not going to fulfill the goals and priorities of the statewide plan to end HIV, getting to zero, or end homelessness if we are not intentional about racial equity. And understanding that in order for us to be able to end the syndemics of HIV and homelessness, that we have to be intentional in our efforts to end structural racism. And so we are very, very committed in doing that. Next slide. And so with that, I want to provide you a bit of an overview of kind of what the session looks like. Gabbled in on January 16th, 2024. The way the calendar is typically runs, it runs from about mid-January to the very end of May, early June-ish. But right now it is set, the calendar is set for them to adjourn on May 24th, although by the Constitution, they have until May 31st in order to fulfill this session of the General Assembly. Some of the most pressing issues during this year's session, of course, is the one thing that they have to do each session, which is the fiscal year 2025 state budget. Understanding that we are looking at the fiscal year 2024 budget, fiscal year, excuse me, is now projected to end with a 1.4 billion surplus, while the upcoming budget, the fiscal year 2025, is projected to face about a $900 million deficit. And so we've heard from legislators and others, to really kind of tamp expectations on new budget spending. The appropriators are already kind of looking at about 1.3 billion in increased funding from education to pensions, healthcare, public safety, and other items. So obviously that will play a huge role in as how the 2024 session unfolds. Also, the impact of primary elections. Understanding that you're probably not going to see very many things really get passed, especially anything consequential prior to the March 19th primary election. And then finally, there are other issues, the ongoing migrant issue. Are we going to see additional funds for that? Are we the continued implementation of the Pretrial Fairness Act, which was, of course, the elimination of cash bail, and then the continued discussion around the health benefit for immigrant seniors and the health benefit for immigrant adults programs, the Healthy Illinois for All that ACES is going to talk about a little later on. And so all of those things are at play and others. There are usually one or two issues that you don't see at the start of a session that kind of creeps up during the session. And so you just have to roll with it. Next slide, please. So I'm going to go on and get started right into, we have 9 policy priorities. So I'm going to try my best to go through these as quickly as possible, while also providing some background as much as possible. And so these first two are probably, I hate to say top, but these are ones where AFC will be leading on. And the first one is strengthening and protecting Illinois' HIV funding infrastructure, or what we like to call SPIFFy. And it is really making sure that we have all of the resources that we need in order to get to zero. And so what does that look like this year? It's going to be eventually legislation. We're still waiting on that draft legislation from LRB because it's an appropriation bill. We didn't really have to worry about the deadline that occurred this past Friday. So hopefully sometime this week or next week, we'll get that and get filed, and we'll get that information out to you all what the HB and SB numbers will be. But we are really looking forward to working with Senator Mike Simmons, Representative Han Nguyen on this bill that will include $2 million for the HIV lump sum, currently funded at about $25.5 million. The HIV lump sum is the state's largest pot of money for HIV and covers everything from HIV education, prevention, testing, treatment, PrEP, Illinois ADAP, so much more. And so it is the largest, pot of money, and we're asking for an increase of $2 million. We're also asking for a new funding for 2.5 for the Rapid Start for HIV treatment pilot, which we will talk about in the second priority that I'll get to in just a moment. And so that would help us be able to create 8 Rapid Start for HIV treatment pilots around the state. This legislation also protects funding for the GTZ Omnibus that's currently funded at 5.5, the African American HIV/AIDS Response Fund that's currently funded at $10 million, PrEP for Illinois program, which was new funding we were able to get in the fiscal year 2024 budget, which we're currently in at $2 million, as well as $500,000 for STIs, which we were able to get in the fiscal year 2024 budget as well. So these are the things that we're looking at. Again, we can't be successful in getting to zero and fulfilling the goals and priorities outlined in the statewide plan if we don't have the resources to be able to do so. And so this really gets us there. Thank you so much for going to the next screen, which is our next bill, which is something that ACES and I and many, many others have been really working really hard on, is the connection to HIV testing and linkage to care, or the HIV TLC. And so that's House Bill 5417, Senate Bill 3711. And so one of the things that we know is that connecting people to testing, getting people tested for HIV, and getting them linked to care is absolutely critical if we're going to be successful in getting to zero. And so this legislation enacts the following reforms. It mandates that insurers and Medicaid have to cover home test kits for sexually transmitted infections, including HIV, without cost sharing. And so the importance of this is at-home HIV testing kits allows people to be able to test safely from the comfort of their own home. This is specific to addressing stigma. You can do this from the privacy of your home, and get that peace of mind that you're able to comfortably test for HIV at your home. Then the next one is something that ACES has been leading tremendously on, is our Rapid Start pilots. As I mentioned earlier, creates 8 Rapid Start for HIV treatment sites that will initiate antiretroviral therapy within 7 days of initial diagnosis, or within 7 days of referral to HIV medical care. Right now, the standard of care in Illinois is within 30 days. We understand that we want to move this through this rapid start for HIV treatment. We want to move that standard of care to 7 days, within 7 days. Because we understand that if we can get someone who is newly diagnosed into treatment, retained in care, to viral suppression, then they cannot transmit the virus sexually. That's also known as something called U equals U. Undetectable equals untransmittable. So that is something that is, again, critical to ending the HIV epidemic by 2030 in Illinois. And then finally is HIV education in county jails. Right now, state law, Illinois County Jail Act states that county jails have to report that they are actually doing linking people to HIV testing as well as doing HIV/AIDS education in the county jails, as well as those who are visiting. Right now, many county jails aren't completing this survey. And so essentially what this reform would do would basically include this in a Department on Corrections annual report that all of the county jails are already doing. So essentially it would take the 5 questions that they're currently not doing and would add them to a very lengthy report that they're already doing. And so we're just, again, trying to make sure that we get that information that they're doing. And so we can also know the ones that are not able to do it. And then we can figure out ways how we can help them and address them to make sure that, that we are doing that critical education and linkage to testing in our county jails. Before I go to the next one, want to say that so proud to work with Representative Kelly Cassidy and Senator Lakeisha Collins on the HIV TLC Act. We were able to get our bills filed by Friday, thankfully. And so both of them have been great legislative champions for us in the past. And we don't see anything changing moving forward with this one. Next slide. Thank you. The next one is House Bill 4472, Senate Bill 3108, which is Prescription Drug Affordability Board, or a PDAB. This is a policy issue that AFC has been working on for quite some time. This was actually, this type of issue was on our policy agenda in 2020, my first year at AFC. And essentially what this would establish a prescription drug affordability board, a independent, nonpartisan body with the authority to evaluate high-cost prescription drugs and set upper pay limits on what Illinoisans will pay. Because again, we understand that drugs don't work if people can't afford them. And so we understand that this PDAB would affect the entire supply chain, the manufacturers, wholesalers, PBMs, insurers, pharmacies, to make sure that Illinoisans are able to pay for and afford the drugs that they so desperately need. And so in a 2020 survey, we were able to really kind of see that 28% of Illinoisans either have not filled a prescription or rationed them due to cost. And 80% of Illinoisans are supportive of establishing a PDAB. And so this is something that clearly Illinoisans want, that Illinoisans need. And we are so proud to be working with Citizen Action Illinois, Protect Our Care Coalition on this legislation. And we are thankful to our bill sponsor, Senator Dave Kaler and Representative Nabila Syed, to work on this critical legislation to address the cost of prescription drugs that obviously is so impactful for people living with and vulnerable to HIV. And so with that, I am going to stop and turn it over to my colleague, ACES, who is going to talk about our next two. Next slide. You can go to overdose prevention site. Thank you.
Thanks, Timothy. So on our list, we also have the continued advocacy for the overdose prevention sites pilot. This pilot would hopefully be established on the west side of Chicago, where we're seeing it's a large epicenter of the current fatalities around overdose in the state of Illinois. What we know is that there's been 75 plus sites established across the world. Not a single death has occurred on this at any OPS. And we know that it's a harm reduction tool that works. Currently, we're in a state of the overdose crisis where we need to expand the harm reduction toolkit. This is another resource that we're know that it's also connected to the Getting to Zero plan, keeping in mind that injection drug use is also connected to HIV transmissions. And if there's a way for us to sort of connect, expand education, provide clean equipment for folks, this is also a way for us to make a dent in the HIV epidemic in the state. So with this, House Bill 2 would establish one pilot site. It would provide folks the connection to existing sort of like medical care. There would be medical supervision of folks using pre-obtained substances on site. That along with a variety of other resources. We look to the sort of model that New York's On Point OPS site has sort of guided us with, and there's a variety of wraparound services that are provided on site. That and sort of the unconditional care, the judgment-free zone that a lot of folks desperately need. We're going to continue the advocacy work, and extremely grateful to the champions behind the Illinois Harm Reduction and Recovery Coalition. I see that some of you are joining the call with us, and also our state representative champion, LaShawn Ford, and in the Senate side with Senator Sarah Feigenholtz. Pass it back to you, Timothy. Or I believe Healthy Illinois is the next one. And then also on this list, while there isn't necessarily a bill just yet, alongside the Healthy Illinois Coalition, we'll continue to monitor the sort of progress around expanding sort of insurance coverage for folks regardless of immigration status. We know that the HIV virus does not discriminate, does not care if you have or don't have insurance. So it's critical that we expand that sort of coverage for folks. Currently, while we're keeping in mind the sort of like budget conversation entering the spring legislative session, the coalition is definitely focused on providing sort of that budget advocacy to ensure that the wins that have been sort of achieved in the coalition are sort of like maintained. The goal is to continue the advocacy to eventually reopen enrollment as it's been currently closed off for folks, to have the opportunity for folks to continue enrolling. Currently, only folks that are able to enroll are from the ages of 42 to 64. That's for the health benefits for immigrant adults. And for folks 65 and older are able to enroll into the health benefits for immigrant seniors program. Currently, we're seeing changes. There's like a shift over to managed care organizations. So for folks that are maybe familiar with the Medicaid program, there's a variety of sort of organizations that sort of help facilitate that. And they're going to do a similar thing for the HBIS and HBIA program. So yeah, and then also, while it's not listed on here, the hope is that there would also be a sort of established task force that would look into innovative ways to making the program also be and continue to be sustainable. There may or may not be a bill that would help facilitate that, but more to come when campaign pages go public. And I'll make mention that we're extremely grateful to have our Senate champion, Senator Omar Aquino, helping us with this program. Back to you, Timothy.
Thank you so much, ACES. And I do want to highlight, ACES has done a tremendous job in working very hard on both Healthy Illinois as well as the OPS bill. So thank him for his leadership on both of those. I think also to ACES' point that he just kind of hinted on is, yes, while we are talking about these policy priorities, understand that the session is about 5 months or so, and that what we're presenting now may look completely different come the end of May. And so I want you all just kind of be mindful of that we may give you a bill number today that by the time we get to the end of May, it's a different bill number. It may be included in another, larger bill. So just kind of be mindful of that. And we will try our best to keep you all updated on all of that as things kind of, unfold. And so I'm going to go into our next one, which is another issue that AFC has long been working on, is around junk plans, junk health insurance plans, or short-term limited duration plans. So Senate Bill 2836 would be a complete ban on those. Right now, AFC worked along Protect Our Care Illinois coalition in 2018 to pass legislation that limited these junk plans to 6 months of coverage. And so we are back to get another bite at the apple to get rid of them altogether. And why are they bad? It's because they are not subject to the consumer protections of the Affordable Care Act. And so the importance of that is that they don't provide the coverage of essential health benefits, and Illinoisans, especially Illinoisans with HIV, can be denied coverage for certain conditions, leading to people going without necessary care or facing higher out-of-pocket costs. And so they essentially stand in the way of one, of people getting the care they need, but then two, us fulfilling the goals and priorities of getting to zero. And so because we cannot get to zero, people cannot get care. And so specifically, as I mentioned, Senate Bill 2836 would ban these junk insurance plans. And we were able to find a study conducted by our colleagues over at KFF that coverage was denied in all 38 short-term limited duration plans as someone living with HIV. So they did a survey of 38 plans and came back that every last time the person living with HIV, the plans were denied. Again, how do we end the HIV epidemic? How do we make sure that people get good coverage if we have these type of plans that are out there? And so this is something, again, that we are proud to work with Protect Our Care. This is an official initiative of the Department of Insurance, the State Department of Insurance. And so we are so proud to be working alongside them, Senator Laura Fine, Representative Bob Morgan, and many others on this legislation, understanding that this bill may actually appear in another bill form. Understanding there's being some talk around a larger consumer protection type legislation. So this language may appear in a different form. But right now, it is Senate Bill 2836. So thank you so much for that. Next slide. Funding to prevent and end homelessness is something much like what we were talking about. ACES mentioned about right now, it may not be in an actual bill form. So there may not be a House bill or Senate bill number attached to this. But we understand that housing is healthcare, especially to people living with or vulnerable to HIV. Understanding that oftentimes housing instability is a huge barrier to people getting into care and retained in the care. And so we are so proud to be working alongside the Center for Housing and Health and as well as others to partner with community partners like Housing Action Illinois, Chicago Coalition for the Homeless, Illinois Shelter Alliance, and the Supportive Housing Providers Association in this advocacy around $85 million in new funding in the state's fiscal year 2025 budget. That will basically cover everything from homeless prevention to emergency shelter, homeless youth programs, supportive housing, and other priorities. As we continue our efforts to make progress on the Home Illinois plan to prevent and end homelessness. And so this is when we're talking about our policy priorities, we are talking about it in the ways of making substantive change. That we are talking about making lasting change. So we're talking about ending the syndemics of HIV and homelessness. And so we are so proud to be working with these community partners, as well as our legislative champion, Representative Will Gazzardi, and many other legislators on this critical funding to prevent and end homelessness. Next slide. Then there is Senate Bill 2158, House Bill 3703, which is we're calling Stop the Revolving Door from Reentry to Homelessness to Prison. Reentry is a huge portion, just like Rapid Start, huge component to getting to zero. Understanding that you have to remove barriers in order to people to get into care, and so our work around reentry is really centered in this. And our colleague Dominique Chu, who is AFC's housing policy manager, is leading our efforts on this. And so essentially, Illinois registry rules and housing banishment laws systematically, if I can get my words today, displace and reincarcerate people, disproportionately Black men with past convictions. And so what this legislation would do would enact the following reforms: reduce housing banishment zones from 500 to 250 feet. And once people find safe and stable housing, grandfather them in. So they're not having to constantly be at risk of losing housing. Uh, because you start the kind of cycle, this vicious cycle over and over again. So we want to grandfather them in. Repeal the extra weekly registration. Register people based on duty to register, not their housing status. And then again, make failure to register a misdemeanor from a felony. Understanding that people again we're talking about reentry, and we want to believe in the hope and good of people, obviously. And so AFC is working in partnership with the Chicago 400 on this legislation, as well as our bill sponsors, Senate Majority Leader Kimberly Lightford, as well as Representative Camille Lilly. Both of them have been great, tremendous champions, especially on the housing side. I'm sorry, the HIV side. And so we are so proud to be working alongside them on this critical legislation. And I want to thank our colleague Dominique for her great work on this as well. And so we will go to our very last one, which is House Bill 5051, which is a ban on prior authorizations in health insurance plans. And I hate to sound like a broken record, but this is yet again another issue of which AFC has long been working on. We were proud to work on prior authorization reform in 2021. And so this is another effort to reform the prior authorization process. As the definition is listed there, it's a requirement by health insurance plans for patients to obtain approval of a healthcare service or medication before the care is provided. However, we understand that these requirements often cause delays for patients, including those living with HIV, and in return can result in negative clinical outcomes. So, what does that mean? Say, hey, you need a prior authorization for this drug. Well, that prior authorization process can take 3 weeks. That means that's a potential for 3 weeks for you to not have your medication. Who does that serve? That's not helpful. And so even the American Academy of Family Physicians contend that prior authorizations can worsen health disparities and create barriers to care for medically underserved patients, patients of color, LGBTQ plus patients, as well as patients in rural areas and those at risk for poor health outcomes. That is essentially all of getting to zero Illinois. And so, our priority populations, when we talk about being successful in getting to zero, we have to remove every single barrier that stands in the way of people getting care, staying in the care, and to reach viral suppression. And so House Bill 5051 would ban prior authorization and health insurance plans for gender affirming care, hormonal therapy, as well as HIV and viral hepatitis treatment and prevention. And so this is being led by Representative Jennifer Laddish Douglas, who we have not traditionally, she is a newer legislator, and we have not worked with her before, but she has been a tremendous, champion for this. She actually kind of reached out to us about this. And so this is something that I'm excited to work with her and many others on. And hopefully we are successful in getting this passed and signed into law this year. And so with that, that's all 9 of them. So what's next? We are going to, just to kind of give you some information, we will have our annual HIV Advocacy Day on Wednesday, April 10th. This year, we're only doing virtual. So this is a way to make sure that we can get as many people engaged in the process. You don't have to go to Springfield, but you can still be engaged in the work that we're doing. So I want to let you know that Advocacy Day 2024 registration will go live February 29th, 2024. If you are not signed up for our mobile action network, you can do so by just texting AFC to 40649, and that will get you signed up, and you'll get all of the deets about, nothing about us without us, virtual HIV Advocacy Day 2024. And that is a great way for you to engage on all of these policy priorities. And so you can go next. Next slide. Next slide. So I'm going to, you can go to the next slide. Want to put up my information before we can stop the screen share just a moment. But I want to provide our information. ACES and I are usually in Springfield whenever they are in session. And so we are the ones that are working on all 9 of these, these policy priorities to make sure that they get passed. Yes, it's a lot of work. But we are really kind of, emboldened by the support of community and how engaged that you all are. And we do this because of community, because we are committed to ending the syndemics of HIV and homelessness. And so if you have any questions, please feel free to reach out to us. And so with that, you can stop screen sharing and see if we have any questions in the chat. Let's see. Someone put, there's 2 questions in here and they're kind of the same. So I'm going to just answer them live. One question says, thank you for this very informative webinar. If I'm interested in a specific bill from what was shared in this webinar, how can I help advocate for it? And then another question, it said, Tim mentioned that the bill numbers and language may change between now and May. How can I keep up with these changes so that my advocacy is as effective as possible? I did not mention, and I should have, so I'm going to answer this way. When I said that our, sorry, just lost my train of thought. Advocacy Day goes live on February 29th. That means that also includes our mobile action center for all of our policy priorities. So you will be able to go through to this site and you will be able to tweet your legislators, email your legislators, all of that. And so it will have all of the latest information for our bills. So bill numbers, all of that as it changes. We will also be posting, as soon as we get them all of our fact sheets for our bills. They will be on AFC's website. And so you will be able to see all of that in one place. And so you'll be able to get all of that information in one place. And then the third place I would tell you is make sure you are following AFC's social media, specifically Facebook and Instagram, where you can make sure that you are getting all of the latest on all things policy, specifically our policy priorities. So any calls to action that we're doing, any time that we're sending out and we need you to submit witness slips, there are other things that we're going to be sharing specific to a couple of these bills, including some ways for you to get engaged in other ways. So yeah, those are all great ways. And make sure, again, sign up for the Mobile Action Network. Okay, so answered those. Brian put, can you tell us a little about what virtual look like? Will you be scheduling meetings with representatives and senators? We will not be doing that, Brian. That is a great question. Thank you so much for answering, for asking that. Because the scheduling, the way that the schedule is for both the House and the Senate is very different that week, we were going to run into an issue to where you were going to have members not there. And so that's the reason why we are not doing that. And we don't want to schedule meetings with people and you not get them. That doesn't help anyone. And so that's the reason, why we're not scheduling meetings. We are considering potentially taking a smaller group down to Springfield later this session. So stay tuned on that one. By the way, it was good seeing you this past Saturday. Let's see. Sasha, how accurate is the home HIV test? Thought that the saliva test is not as accurate than a blood test. From what we understand, Sasha, that these are very accurate. And so what we are seeing is really even the federal government is kind of hopping on this bandwagon to increase the usage of home testing. Again, especially as we have seen HIV testing numbers drop because of COVID. And so again, we're really looking at this as an opportunity to, one, save people money, because this would be that they would be covered without cost sharing, but then also addressing stigma. These are things that are already on the market. And so this is a way to get people linked to care and linked to better HIV testing. Another question: what has happened to legalize sex work? Right now, those conversations are still ongoing. Again, I want to highlight, I mentioned in my opening that this year is an election year. So you have to be very, very strategic about the bills that you run during an election year. And so, those conversations in the coalition, ACES leads our work on those conversations. They're still ongoing. It's just a part of the process. ACES, do you have anything else you want to add?
Yeah, just to add a little bit of context too, in terms of the coalition work that we're currently involved with, there's like a sort of effort to sort of scale up. So right now there's like a focus on the county level, looking into introducing something there, trying to garner support on that. And while our focus is largely, our expertise is on the state level, we're just doing what we can to support. And then the other piece is also the coalition that we're involved with isn't looking at legalization, they're looking at decriminalization. So sort of like that nuanced sort of understanding that if sex work were to be legalized, it would still leave out folks that don't necessarily have access to like gathering the necessary resources to have a license, et cetera, to like operate sex work. What we want to reach are the folks that are often sort of at the margins and doing street level sex work, and trying to reduce the harm in that way by decriminalizing altogether.
Thank you so much, ACES. Another question, great question. Do you feel like it being an election year will impact AFC's ability to move any of these bills forward? Potentially. I am a realist. And there are potential, that several of these could be hampered because of an election year. But that does not stop our work. We continue no matter what. That's the way we've always done it, and the way we will continue to keep trudging ahead. Most bills, just to be very honest with you, take several sessions to get passed. And so this is nothing new. As I mentioned, PDAP, we worked on that one in 2020, weren't able to get that one passed. We're back now in 2024. The overdose prevention site. This is now, I think, our third session that we're working on this. And so, yeah, it's just, it's the way things kind of go. But you continue the work until you get it. Rate review, which we were able to get last year, had been working in those circles for 10 years to try to get it. And so, obviously, things change. But yeah, an election year could definitely impact the ability to kind of our work. Great question. Great question. Another person said, will we get a recording of this webinar and slides? Yes, you will. You will get a copy. The recording will be on AFC's website, but it will also be sent out, as well as the slides, as well as our evaluation survey. Emilio, could you put that in the chat as well? We would love for you all to fill out our evaluation survey. It's only 9 questions. Shouldn't take you very long. But yes, you will get all of those. Let's see. Does the Connection HIV Testing and Linkage to Care Act compel? Oh, I love the way y'all wrote that out. Yes, love it. Compel coverage of at-home tests provided by healthcare providers, hospital clinics only, or also commercial companies. It is only limited to insurers and Medicaid. And the final one says, how can we join the coalitions you mentioned? Are there ways that we can support good policy outside of Springfield session? Yes, there's ways that you can get involved with Healthy Illinois, the Illinois Harm Reduction and Recovery Coalition. Yeah, just about, if I'm not mistaken, most of them. You can get engaged with. Tell you what, if there's a couple that you are interested in, or whichever ones you're interested in, please feel free to email me or ACES, and we'll be more than glad to get you linked to any of those coalitions that you're interested in. So, any other questions? And as I mentioned, my colleague Emilio, thank you, Emilio, just put the link to the survey in the chat. We would love for you all to fill that out. I do want to let you all know that the work that we do, yes, while it's 9 policy priorities, which I'm going to be honest with y'all is a lot. But that is typical AFC. We usually have a very comprehensive policy agenda, but I want you to understand that it is not an exhaustive list by no means. Does not encompass all of the work that we're doing, the policy work that AFC's policy advocacy team does on the state level. It does not include a lot of the administrative advocacy that we're doing. It does not include the implementation work from previous bills that we're doing. It does not encapsulate the work that our colleagues Dominique is doing in the housing space, or Omar on the federal level, the local level. Also does not include the Bring Chicago Home campaign, which we're working on, and so many other things that we're looking on things like a potential for next year, an LGBTQ long-term care Bill of Rights bill with our partners at AARP and SAGE and Equality Illinois. And so, again, this is a very small snippet of some of the work that our team is doing. And so that meaningfully addresses racial health equity, as well as moves us closer to ending the endemics of HIV and homelessness. So I do want to take this moment to thank my colleague ACES and Dominique and Nadine and our comms team, our fabulous comms team that has worked so hard to pull a lot of this together. And anyone else that I have forgotten, apologies, y'all. It's a crazy day. And so anyone have any additional questions before it looks like I give you all some time back in your day? Alrighty, y'all. We'll stay tuned. Again, I put in the chat earlier, if you didn't see, both our state policy priorities, a one-pager front and back, as well as in Spanish. Put those in the chat as well. So please feel free to look at those. And you're welcome, Brian. Thank you. And thank you all so much for joining us. Again, make sure you please fill out the survey. If you have any questions, please feel free to reach out to ACES or myself. And the next you will hear from us is a follow-up email, and then you'll hear from us next week because the governor will be unveiling his fiscal year 2025 budget in his State of the State address next Wednesday. So, of which we will have a response to. So again, thank you all so much for joining us. I hope that you all have an enjoyable rest of your Tuesday. Have a great one. Bye-bye.